So we are looking at Salmonella. So Salmonella causes typhoid fever, which is a life-threatening illness. So in the United States, about 400 cases occur each year. 75% of these are acquired while travelling internationally. So international travel is a reason why you end up with typhoid fever. And it is common in the developing world where it affects about 21.5 million people each year. So Salmonella is a gram-negative bacteria and it is motile except for Salmonella pylori. So it grows colonies on MAC and selective mediums. It also grows in Wilson and Blair bismuth sulfite and it has jet black colonies due to hydrogen sulfide. So Salmonella paratyphi produces green colonies which indicates there is no hydrogen sulfide present. And the enrichment media for this is selenite F and tetrahydroionic broth. Diseases caused by Salmonella include enteric fever, which is caused by Salmonella typhoid fever, and then Salmonella paratyphi A by ABC, which causes paratyphoid fever. Food poisoning, which is essentially due to animal parasites, which also infect humans, and this is caused by Salmonella typhimurium and Salmonella enteritis, and septicemia, which is caused by Salmonella choleraesis. So the source are carriers, other cases, and poultry and dairy. Transmission is ingestion of contaminated food or water, and this results in a high infectious dose of around 7 to 14 days incubation period. The virulence factors include the invasiveness, intracellular survival and multiplication, and endotoxins. So how does Salmonella infect? So Salmonella are ingested in contaminated food or water. The organisms reach the terminal ileum, resulting in enteritis. So the organisms invade the gut wall and cause ulceration and perforation, hemorrhage. Or the organisms spread to intestinal lymphatic and are phagocytosed by macrophages. Organisms disseminate to bones, kidneys, lungs, liver, brain, and blood, and this results in enteric or typhoid fever. So salmonellosis is a general term for a disease, and as I mentioned before about enteric fever, septicemia. So enteric fever, the prototype is typhoid fever and is less severe than paratyphoid fever. Septicemia caused by particularly S. choleraesis, S. Salmonella typhi, Salmonella paratyphi, and you have asymptomatic carriage. So the gallbladder is a reservoir for the Salmonella typhi here. Symptoms are nausea, vomiting, fever, bradycardia, toxemia, soft palpable spleen, hepatomegaly, and rose spots in the second or third week. To diagnose enteric fever, you need specimens from the blood, bone marrow, urine, stool, plus cerebrospinal fluid. So the first week, we would do a blood culture, PHI broth. Second week, antibody detection via serum and a Whittle test. Third week, urine culture. Fourth week, stool culture. And you use selective enrichment medium. So for the blood, urine, and stool, you have NLF colonies, jet black colonies in the stool, TSI agar, potassium negative, hydrogen sulfide positive. For the Whittle test, this is a tuberculation test to detect antibodies in the patient's serum. So the test is performed after 2 weeks to diagnose enteric and typhoid fever. The antigens used are, as you can see here, TO, TH, AH, BH, CH, and each is an antigen of a specific species, such as O antigen of S. typhi, H antigen of S. typhi, H antigen of paratyphi A in the case of TO, TH, and AH. So the O is group specific, enteric fever, and H is species specific, typhoid or paratyphoid. So the test is carried out by double dilution of serum. So you get an amnestic response with a TAB vaccine, demonstration of rise in titer. Cases treated early can show a poor antibody response, and a titer here is suggestive of typhoid fever. Carriers include food handlers and cooks. Repeated stool cultures. The Whittle test is no value in endemic countries. VI agglutinates indicate carrier status. Sewer swab technique tracing carriers in cities has been used. And the vaccines include TAB, Typhoid, and Typhon vaccines. So currently, for treatment of drug resistance, fluoroquinolones such as ciprofloxacin or 3GCs are used. 3GC meaning third generation cephalosporins. But previously in 1948 there was availability of chlormethazole. Then in 1972 chlormethazole resistance occurred. Then there was an epidemic in Mexico, epidemic in Kerala, India. Then there was an endemic confined to Kerala in 1978. An alternative used at the time was ampicillin, cotrimoxazole, and fluorosilidone. And then after the 1980s, there was multi-drug resistance, MDRS, typhi, and resistance to ACCOT. So resistance to ACCOT is ampicillin, cotrimoxazole, etc. But currently the choice is fluoroquinolones, ciprofloxacin, or 3GCs, first generation cephalosporins. So if you're travelling in a country that has got risk of salmonella, definitely avoid ice, drink only bottled water and pasteurised milk, consume cooked food, and think about getting a vaccination. That's it to the end of today's video, so I hope you enjoyed it and have fun.